So welcome, Trevor. It's very exciting this morning that I've got some time with you to have a conversation about advocacy. This has been brought about through the Australasian Society for Physical Activity. For those viewers and listeners not familiar with the new Australasian Society for Physical Activity, I'd encourage you all to check out the website, asperactivity.org, and then you can connect with us on various social media platforms, which hopefully you can now see along the bottom. Before I get stuck into the interview with Trevor, I'd like to pay my respects to the traditional custodians of the land in which we're both meeting today, and acknowledge the emerging elders past, present and emerging. And I'd also like to frame that I'm personally very excited to have this time with you, Trevor, as I'm very excited to hear all your thoughts about advocacy, physical activity for this morning's interview. So thank you very much for joining us, Trevor.
No, thank you, Lindsay. It's my pleasure to do so. I'm also always very happy to talk about advocacy, given its central importance to what we're here for.
Fantastic. So what I will do, so you can see your face a little bit more clearly, which hopefully we can do so now. I guess I'd like just to kick off with perhaps introducing yourself. I know you are an absolute legend in advocacy, and many of us will be familiar with your work, but I always like to give the opportunity to put in your own words your introductions and share a little bit about your story.
Well, without getting into a lengthy CV, the best way to describe me, Lindsay, is I'm a prac academic. So, which is a made-up word, which is the cross between practitioner, advocate, and academic. So, I have 2 adjunct appointments at Curtin University and UWA. I'm an active researcher, actively involved in researching and publishing in physical activity. I've run community-wide campaigns, social marketing campaigns, and initiatives in physical activity at a local, national, and global scale. And my passion above all of that is advocacy, because as we will discuss, I think advocacy is the best investment when it comes to return on investment and the ability to make a difference in people's lives and advance our physical activity agenda. So bit of a weird word, prac academic, but whatever that is, it's a combination of those 3 things.
Oh, I think it's fantastic. And I think that's a nice segue into, I guess, my first question, which is actually around language. And for me, there's advocacy is a term that we hear a lot. We hear a lot of people using it. I'm not necessarily sure that we all kind of understand it that well. I know I'm continually learning what it means. I guess I'm really interested in what are your thoughts on when we use the term advocacy. What does that mean?
Yeah, I think your observation is correct, and it's often used and not as well understood as it is used. At its simplest core, advocacy is about mobilizing change. And, its historical roots were in people advocating on behalf of the dispossessed or the poor, and it still is that. But in more recent times, it's taken on a more sophisticated systems and policy notion. And I use the term systems and policy advisedly because it is a combination of approaches that bring about political commitment, funding changes and system changes. It really works at that level rather than at the individual behaviour change level. It's about system supports, policy supports, funding supports that enable physical activity to flourish and be effective. It's worth saying that as a strategy, it's underutilized, it's under-resourced, it's under-researched and undervalued, given what I said earlier about its potential for return on investment. Advocacy done well, just look at tobacco control, just look at the environment movement, look at other endeavours in social change. The return on investment on advocacy done well is spectacular compared to almost anything else we can do as a professional body.
So tell me, why do you think it is then under-resourced and undervalued?
Oh, that's a really good question. It's even in areas where it's got a proud history, it is. The best example of that is tobacco control. And we can learn a lot from tobacco control. It's an area where at the very same time that increases have happened in physical activity and obesity has doubled or tripled since the mid-1980s, we've cut smoking prevalence by 2/3. And advocacy was the key factor in that. So yes, we can learn a lot from that around, what did they do? They had very astute leadership. They mobilized strong coalitions. They developed a very strong, consistent song sheet. a consensus about what needs to be done globally and communicated that consistently and persistently. And this wasn't a massive movement of thousands of people either. This was a small group of media savvy academics and policymakers who were persistent with what needed to be done to make a difference. So we got a lot to learn from that. It's not directly analogous to physical activity. In fact, physical activity has some advantages over tobacco control in terms of the tens of thousands, if not millions, of people we can recruit as allies. But we can learn a lot from success in other areas.
So you touched on there, like how advocacy can operate at different levels. Within that, then, if we're thinking about definitions and language, are there different types of advocacy then? Are there different forms in which it presents in? Because we generally use the kind of broad umbrella of advocacy as kind of the bucket for everything, but within that, it sounds like there are different types of advocacy.
Yes, and this is a really critically important point because it's also an enabling point because any of us can advocate at our own level. So when you say advocacy, we tend to think about knocking on a minister's door or political advocacy. And of course, political advocacy, I was just referring to it in the tobacco context, political advocacy is absolutely centrally important. But I tend to talk about advocacy in at least 5 domains. And so political advocacy is one of them. So of course, submissions and budget submissions and meeting with politicians, inviting politicians to launch things, keeping it on the political agenda is very important. The second area is media advocacy. People consume media. Nobody consumes media more ravishly than politicians. So having your issues in the press and in the headlines and in the public's mind is good advocacy on a whole range of levels. 2 related areas are professional mobilisation and community mobilisation. And I touched on this earlier. So this is a strong suit for physical activity compared to other areas. We have millions of friends. Now, whether that's in sport and recreation or parks and gardens or allied health professions like physiotherapy and podiatry and so on, public health and health promotion, there are many, many ways these days where we can mobilise professionals around this agenda, and ASPA has a key role there. Community mobilisation likewise, especially with the new platforms at our fingertips with Facebook and other social media platforms. We've seen terrific examples of physical activity related social mobilisation, even under the COVID-19 environment where people have been advocating for open spaces and walking and cycling infrastructure around the community. And the 5th area is organisational advocacy. So we don't think about that one so much, but this extends to things like who's on your board, how you advocate to your boss. A lot of government people say, I can't advocate. Well, I would say in response that when you send an email to the boss saying, have you seen this great new article in The Lancet? It highlights X, Y, and Z. That's advocacy. And so that broad frame that I'm talking about, political, media, professional mobilisation, community mobilisation, and advocacy from within, there is a role for every one of us in that. You might not be the person fronting Channel 7 or going to meet with the minister. You might be the person preparing the data or the speech notes or writing the first draft of a submission, but there's a role for all of us across those 5 domains.
That's great to hear, and it definitely, I'm sure, is reassuring to many of us that even those small things actually all contribute to the bigger picture, and that we're all real champions within our own kind of daily jobs or even our personal lives. I think like you say, social media is a huge platform for that too. You definitely get your kind of champions through the social media platforms. I guess following on from that though, is there any specific competencies that enable people to execute advocacy more effectively? For those of us that are kind of wanting maybe a more professional role in it, are there any particular competencies that you think are beneficial for successful advocacy?
Yeah, it varies across the components that I just discussed, but generally speaking, the competencies fall into 2 headings. I call them the science and the art of advocacy. So the science is really understanding the healthcare system and other systems and other policy contexts into which you're playing, understanding the evidence, the health content, and also how to use data to your advantage. So there are a lot of, if you like, technical and scientific competencies that inform advocacy. But then at the end of the day, there's no substitute for persistence and media savvy and personality and translation of that into a soundbite or a tweet or a headline or a press release. So this is where the communication and what I call the art of advocacy comes in. So it really is, and this also points to there being a role for everyone. These are different skill sets. You know, the scientist or the researcher who might be preparing the arguments, and the communications professionals who are converting that into a infographic or a short video or a press release or a submission. Those skills to mobilize that I was talking about before, that's a skill set that's different as well, mobilizing professionals and working with community groups in community development contexts and so on. So, yeah, broadly speaking, there are scientific competencies and there are the art, or some might call it the dark art, but they form the competencies that make good advocacy. There are very, very few people in the world who have all of that wrapped up in one person, which comes back to what I said earlier about the importance of a team approach.
And everybody has a role, to play. I think. Yeah. Do you challenge the myth then that to be a successful advocate, you have to be the loud, confident, kind of bolshy person on the media all the time?
Absolutely, yeah. So that's what you see in the media all the time. But there are wonderful examples of community level advocacy, the power of one, if you like. You know, where one person changes a law or an outcome for their community or for their family. And these days, as I've touched on, the use of social media and other platforms to mobilise concerns just brings the community into sharper focus. But anybody who's working in physical activity, I'd go a step further than saying they can advocate to saying they should advocate. There is a role for all of us in it.
Fantastic. So I guess then thinking about where there's examples or I guess case studies of successful advocacy, you mentioned earlier on about kind of tobacco control. What do you think are some of the key imperatives for successful advocacy?
Well, someone once said to me that there are a million principles, but the four key ones are persistence, 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 and persistence. And I say that because we reflect upon the tobacco miracle as if it was a miracle. And it was 30 years of hard work. And unfortunately, whether you're talking about obesity or physical inactivity or tobacco control or reducing the road toll or immunization, there is a big gap. Historically, there's a big gap between the evidence coming in and realistic policy progress. So in tobacco control, that was 20 to 30 years. We don't have the luxury of taking that long to turn around physical inactivity or obesity and related chronic disease concerns. So the lessons, I guess, point to how you can accelerate progress. I've touched on how some forms of media will enable us to do that better now. But the lessons, I've touched on three just then around if you were going to look at examples of where public policy and sophisticated advocacy have made a difference in public health, I would point to tobacco control, the reduction of the road toll, and immunization as three success stories. They're not the only ones. And they often take a combination of the types of approaches that I mentioned before to achieve that over a long period of time. Being prepared to accept small wins along the way. Where persistence comes in, I've heard people say, oh, look, we tried that, it didn't work. Well, try it again and again and again. Use a different angle, use different evidence, use a different ally, a different touch point. So I can't underestimate enough the power of persistence. It's a frustrating game because it takes time. But, suddenly something happens and you go, wow, how did that happen? When Minister Roxon in tobacco control turned around and said that we're going to introduce plain packaging of tobacco in Australia. There were these tipping points. The announcement and proud moment where it was passed in the World Health Assembly that we were going to have a global action plan on physical activity. But that didn't happen overnight. That was a lot of persistent advocacy that got us there, and ISPA played a key role in that. So yeah, persistence is really important, and all of those strategies need to be applied on a regular basis, not once.
Well, I think you're a true testament to persistence, and I think the reason that you probably are an advocacy legend around the world and here in Australia is due to your persistence and commitment to the cause. So I think it's wonderful advice that you're giving us, and I think persistence, more persistence is clearly key. So shifting then to kind of physical activity, what are the key priorities for physical activity advocacy, I guess, firstly in Australia and then thinking maybe more broadly around the world?
So if I can just answer that question by touching on another important principle, Lindsey, we need to mobilise our evidence into consensus around what needs to be done. So again, I'll refer to tobacco control, because I can assure you, you could pick up the phone now to the 10 leading tobacco control experts in the world and ask them, what do we need to do? And they will all give you the same answer. Now, they didn't get there by accident. They will tell you that you need to increase taxes, you need to have hard-hitting quick campaigns, you need smoke-free public policy, you need plain packaging and graphic health warnings, and you need cessation support. It's enshrined in a World Health Organization framework convention. So for us, the question you're asking me, we were really quite a disparate bunch 10 years ago, 15 years ago. Very, very passionate. Physical activity people are passionate. But if you ask 10 people what we needed to do, you get 100 different answers. So we've worked really hard to build global consensus. And so there are some examples of this. I could hold them up, but I don't know how that works on Zoom. Things like this one, the 7 best investments on physical activity from ISPA. In the Australian context, the Heart Foundation's Blueprint for an Active Australia. I mentioned earlier the Global Action Plan on Physical Activity from WHO. We're getting there because all of those documents are saying the same things. You need to address urban transport policy. You need to address healthy urban planning. You need robust, comprehensive programs for all school children. You need active workplaces. You need prescription and addressment of physical inactivity in primary care. So those are the ISPA, or some of the ISPA 7 best investments. They're all in the Blueprint for an Active Australia. They're all in the Global Action Plan. And I think we are getting closer as a movement where I hope that in the not too distant future, you could pick up the phones to the 10 leading physical activity advocates around the world and say, what do we need to do? And they will all give you the same answers as well. So I think we are closer to that.
But clearly, there's still more work to be done.
Yeah.
And I guess we couldn't really have a conversation this one without recognising COVID-19 and the opportunities and challenges that this current pandemic brings. What are some of those opportunities and challenges from a physical activity advocacy perspective?
Yes, across the world, I mean, the language that gets used in relation to COVID-19 has been about preparedness, and how you deal with this as a nation, or globally for that matter, as a reflection of preparedness and then global mobilisation of the effort. A lot of the discussion in Australia now and elsewhere around the world is shifted to build back better. And I love that term. That comes from the World Health Organization. But recovery, or building back better, you can understand why I would like that phrase in relation to physical activity and environments. I think we are all seeing a really pleasing focus and an increased community recognition of what they've missed. They've missed getting out and about. They've missed being able to be active in their communities, and the community connection and mental and social health benefits that come from being active together. There has been, in some surveys, demonstration of an increase in cycling and walking. There's a lot of focus on that in infrastructure packages and recovery plans from state and territory governments and the national government and other governments around the world. Really good examples in New Zealand and nearby in Australia and elsewhere. And wonderful example in France of building cycling infrastructure as part of the COVID recovery. So it has been quite interesting and encouraging, the new focus that it's provided for physical activity. So we need to capitalise on that, and this is where you swing in the skills, you swing in the principles that I said before, and you work at the political, the media, and the professional mobilisation and community mobilisation levels to capitalise on that opportunity, which is going to be short term. So let's jump on it while it's there. It's particularly evident at the moment in walking and cycling.
Yeah, so I guess it's kind of keeping that momentum going, and in some ways not getting too bogged down with the challenges, is it? Is it also focusing on how we can kind of use momentum to drive for positive change and focus on what opportunities it does bring?
Yeah, I think as academics, wearing one of my hats, we always get fixated on what we don't know yet. And, you can achieve miracles by implementing what we already know. And so I think that's a really important message for academics and their role in advocacy, is that we have pretty good intel on how to build a community that promotes physical activity and the role of walking and cycling infrastructure and public open spaces and activated streets in promoting people's health. So I think we need to probably get a little bit better at espousing and advocating what we already know, while at the same time as academics, of course, we acknowledge that there is always more to be known. Let's face it, we don't have a job if there isn't more that needs to be known. But I think we need to get probably a little bit better at if everything that we already know was implemented, we probably wouldn't have a problem.
And yeah, I think it's also bridging that evidence translation gap, isn't it? We need the scientists to kind of keep generating the evidence, but it's also around having that close communication with policymakers and everyone out there in the community and organisations to actually start implementing what we do know. Because, like you said, there's still some work to be done on that side. Well, Trevor, you've answered my kind of questions amazingly, and I've certainly taken some lessons from already what you've spoken about. One of the things I did do, I've used the wonders of social media to reach out to the community to find out what other people are interested in finding out from you. So I've now got a couple of questions from the Twitter sphere, and those people that have put their questions to me, I'm going to thank them personally for each question. So to kick us off with the Twitter questions, I had a question from Bridget Foley that came through, which was, and I think you've alluded to this earlier, around the consensus of messaging. Was with so many options of what could be done to increase physical activity levels, giving a single answer so what should we do now, which is a frequent question to academics from policymakers, can sometimes be quite daunting. So Bridget's question is, what is your advice on how you handle this situation, and what are the next actions needed to help support the GAPA target? So by GAPA, I mean the Global Action Plan for Physical Activity.
Yes, well, that target, by the way, has been adopted by the World Health Assembly, so it's everyone's target, including Australia, New Zealand, and the nearby region. So, we really do need to mobilise consensus, as I've talked about on a couple of occasions, and have a consistent answer whenever we're challenged on what we need to do. I think the evidence is sufficient now to put our hand on our heart around the 4 themes of the Global Action Plan, the 7 investments, soon to be 8 investments from ISPA, the Blueprint for an Active Australia. We do have good consensus about what we need to do, and we need to be consistently presenting it. It is really appreciated by the media and by ministers when you do that. I've had ministers say to me that they're really impressed by tobacco control advocates because they're strong and they're consistent and they say the same things. They get well-meaning advocates from other areas who will come in and tell them something different. They're equally passionate, but they're not strong on their message. So I think there's a very important message for us there, and to mobilise our efforts around the 7 or 8 or 9 things that really matter and say them consistently.
So I think, to summarise your answer there, it's around use the evidence that's out there, put your hand on your heart and be clear and consistent with those clear messages within those documents. Consistency and persistence, I think, are the 2 key words I'm hearing from you there.
And depending on the form of advocacy, being succinct. In Twitter, there's a limited number of words. If you're doing a radio interview, You've got to say it in 30 seconds sometimes, and other times you've got a longer interview like this one. So I refer to that as the art of advocacy, converting 500 pages of science into a soundbite. That's a particular skill set that's really important.
It's actually probably one of the wonders of Twitter. It certainly helps me, who being succinct is something I always struggle with. The next question comes from Jo Chow, who's an academic in Australia. She's put, how can you promote accessibility and inclusion more? During lockdown, I've knew and heard of so many people who wanted to be active but can't. How do we rectify that?
Well, I think the underlying, thanks for that one, Jo, because I haven't touched on inequity more broadly. And I think it's really important to acknowledge that the opportunities to be active are variable in different communities because of economic circumstance, social determinants of health, lack of access to transport, living in unphysical activity friendly environments. So what I take from that question is, the reason it's raised, I think, in the COVID context is COVID has also really strongly highlighted those inequities. Mm-hmm. You just look around the world at who is sick and who is dying. It's tragic, but it's concentrated in poorer communities and disadvantaged groups. So we need in our advocacy to be their voice and to, in the things that we talk about, whether it's the availability of programs or built environments or infrastructure, to prioritise those environments where it's needed most and advocate at those levels. So I think the underlying point in Jo's question around equity is critically important. Takes on other dimensions too, being mindful of culture, being mindful of gender differences, of the needs of older citizens as well.
Fantastic, thank you. So I've just got a couple more questions. I had one from Matthew McLaughlin, who's asked, how can we use our mass media in Australia to focus more on this? And this is a context from Fiona Bull, mentioned in October 2019. The next big game changer in physical activity is to increase public understanding of what is physical activity and what it really means. So the question is, how can we utilise our mass media in Australia to focus on public understanding around physical activity?
Yeah, so there are two types of media. There are more than two types of media, but there's paid media, and we need a commitment from our government in a national physical activity strategy to a paid advertising campaign, which is ongoing. So we have one at present through Sport Australia, but that kind of paid, structured, mobilised approach to this, in the same way that we've had quick campaigns for 25 years. We need. But in the unpaid media space, this is also the bread and butter of advocacy, that we all need to be, whether it's on Facebook or on Twitter, right through to being interviewed on Channel 7, develop skills to get our message across. And it's not just a question that it's about what physical activity is. It really is about communicating the benefits and how and where you can be active in your community. A lot of the research, the social marketing research that I've done, indicates that there's overwhelming agreement that physical activity is good for you, but people don't really appreciate just how good it is for you. So I think there is a really key role for public education in that, in all of its forms, unpaid media. So I work for the Heart Foundation. That's my role day to day, is to be a media spokesperson, literally day to day. And I couldn't emphasize enough how important that is. Getting the radio interviews, getting the spots where you can on television and all forms of media to talk about this wonderful thing that is physical activity and raise community awareness about its benefits and its importance.
You touched on the actually around education and kind of development opportunities. I had a question through from someone who said, what training opportunities currently exist for advocacy, and what advice would you give to a researcher who's interested in getting more involved in advocacy?
So I mentioned before that advocacy is underutilised, under-resourced, under-researched, undervalued. And part of why I say that is because there isn't a structured, mobilised way of building that skill set. So I think whether it's ISPAR on a global scale or ASPAR on an Australasian scale, there is a role for us in running short courses, running webinars, running skill building sessions, So we do it, but we don't do it anywhere near the scale it needs to happen. Get it included in university courses as well. So the kind of models that I've been referring to really do lend themselves to skill development and strategy development, where you can sit around and develop a strategy based on some of the things I said earlier. Pick your advocacy objective, might be walkable communities or physical education in schools, and work through a strategy of what is it exactly that you're asking for, what mix of community mobilisation, professional mobilisation, media and other strategies you're going to use to get there. I think there's probably a key role for the new Australasian society and working hard to build that skill base in professionals, in researchers and in the community.
Definitely, I completely agree with that. And the last question that's come through on Twitter was a question around schools. This has come from Emily McLaughlin. What could schools do in a systematic way to help young people reach physical activity targets?
So there's a whole movement around active schools and the health promoting school, which is really a microcosm of broader health promotion language. So in essence, two of the greatest things we can do actually as a society to get more kids moving is to have a robust mandatory physical education program for all kids to promote walking and cycling to school. Those first two things I just mentioned would make a massive difference in terms of kids reaching guidelines. But in addition to that, address the school environment, its playgrounds, its spaces, its activities that are available during breaks, and the school's outreach to the community through sport and recreation and through parents. There's a massive body of literature around the health promoting school and active schools, but the question's a good one, because if we really want to make a difference into the future, we really need to focus on our kids, and schools is not the only avenue, but one critical avenue for that.
Fantastic. Well, I think that's all the questions I have from me, Trevor. Thank you so much for your time. Have you got I've got one last fun question to ask you on a more personal level, but before I ask that, is there any other comments, thoughts, advice, queries you kind of would like to share as a final note?
My only plea is let's keep the conversation going. That this is not something, I use the word persistence a lot, but we really need to step it up, and through our professional societies and through our networks, let's keep this momentum and make every post a winner for getting our communities more active into the future.
Fantastic. So my last kind of fun question, which I'm going to put you on the spot with this, was can you share a fun fact or something about you that you think people might not necessarily know about you? It could be anything that comes to mind.
Fun fact. Well, I've had some frustrations in my life. One of which is I'm a very frustrated musician. So I actually was given a guitar for my 60th birthday. I had a guitar for a couple of years when I was about 21, and then my had a daughter. She started playing guitar and got better than me in 4 weeks. So I have not picked one up since. So on my 60th birthday, I picked one up again, and I've discovered YouTube, which didn't exist the first time I tried to learn. So it's not so much a fun fact, but I am having a lot of fun seeing my guitar skills improve. And I should not be saying this, because people are now going to ask me when I see them to perform, which I won't be able to do. But yeah, that's something I'm getting a lot of enjoyment out of at the moment, Lindsay.
And we have to start sending you some requests of tunes to play. Thank you so much.
And I'll select one from the repertoire of about 4 that I've got.
That sounds like a challenge. Thank you so much for your time, Trevor. I've thoroughly enjoyed it. Thank you so much. I've definitely learned a few things. I'm sure everyone else has too.
No, thank you. A very important conversation.
Fantastic. Thanks so much.